Hello there.
Hiya.
My name's Tom Searle. I'm one of the final year medical students, and I've just been asked to perform an examination on you today. Can I just take your name and your age, please?
Yeah, it's Catherine Chatfield, I'm 24.
Can I call you Catherine? Is that okay?
Yeah, it's fine.
Nice to meet you, Catherine. Just going to wash my hands quickly. So I've just been asked to perform a cranial nerve exam, which are the nerves of the face and the head. And in order to perform this, I'll need to have a look both in your face and your eyes, feel around your face, and do some movements of the muscles of your face as well. Is that okay with you?
Yeah, that's fine.
It shouldn't cause any pain or discomfort, but if it does at any point, then you can let me know and we'll stop. And I'll be talking out loud to my colleague as we go along, if that's okay.
Yeah, fine.
All right? Okay, so first of all, from the end of the bed, I'm just inspecting Catherine, seeing that she's well at rest, that she's not struggling to breathe, or there's no other abnormality present. Looking around the bed for any paraphernalia suggesting a cranial nerve deficit, such as glasses or hearing aids, and there's none present, so that's fine. So first of all, I'm going to just check for olfactory nerve. So Catherine, have you noticed any change in smell recently at all?
No.
No. Okay, so that's fine. I'm going to move on to the optic nerve. Do you wear glasses normally?
No, I don't.
You don't. Okay. Have you noticed any difference in your vision recently?
No.
Okay. So first of all, to test this formally, we use a Snellen chart, which is displayed here on the side. We have one about 6 feet away from the patient. So Catherine, if you look at the Snellen chart ahead of you, and if you just cover one eye with your hand, and then read the bottom line for me.
A-E-I-O-U.
Brilliant. And then swap hands to the other eye, and again read the bottom line.
A-E-I-O-U.
Okay. And any difference in the vision there that you notice?
No.
Okay, so acuity seems normal. I'd then move on to test colour vision using Ishihara plates, but we don't need them for now, so we'll move on. Have you noticed that you've been had problems with colour vision in the past, or been told that you had problems?
No.
Okay, so we'll move on for now. So now we're going to move on to test the fields of your vision. First of all, I'm going to check that I'm going to put my arms out to either side, about ½ metre away from the patient, and I'm going to waggle one of my fingers, and I'd like you to keep looking at me, but with your hand just point to the ones that's waggling, okay? All right. Okay, good. Okay, so that was fine, thank you. Now I'm just going to check for the fields. So if you cover your right eye for me, I'm going to cover my left eye at the same time. I'm going to put my arm to the right hand side, the same distance from me and the patient. Can you see my finger here?
Yeah.
And here?
Yeah.
And here?
Yeah.
And if you keep your hand on that side, I'm going to swap hands. Can you see my finger here?
No.
Tell me when you can.
Yeah. Yeah. Yeah.
Okay, so the fields are normal in the left eye. And again, now if you cover your left eye for me, I'm going to cover my right. And the same thing, can you see my finger here?
Yeah.
And here?
Yeah.
And here?
Yeah.
And if you just keep your hand there, I'm going to swap. Can you see my finger here?
No.
Tell me when you can.
Yeah. Yeah. Yeah.
Okay, so the fields are all intact there. So now I'm going to move on to reflexes. So first of all, I'm going to inspect the eyes. If you just look at the far corner of the room for me, taking a closer look at the eyes, seeing that the pupils are normal diameter, that there's no, that they're symmetrical both sides. I'm looking at the orbit and the conjunctiva to check that everything's normal there, and it seems that everything's normal. If you focus on my finger for me, I'm going to move it closer to your face, and I'd like you to just keep tracking it with your eyes, please. So accommodation is normal, thank you. I'm now going to shine the light in your eye. So again, if it's causing too much discomfort, just let me know and we'll stop. Okay, so again, if you just stare at the far corner of the room, I'm looking for direct and consensual constriction of the eye. And again, on the left side, direct and consensual. And I'm going to do the swinging light test. Swinging from one eye to the other and seeing that they constrict when the light falls on that eye. And so there's no evidence of any RAPD. Okay, so ideally I would like to move on to fundoscopy using the ophthalmoscope, but for the purposes of this exam we'll move on. Okay, so now I'm going to check the movements of the eyes. So this time if you focus on my finger, I'm about ½ metre away from the patient, I'd like you to keep your head still, but follow my finger with your eyes, please. Do you notice any blurring at all?
No.
Or any double vision?
No.
And does it elicit any pain?
No.
Okay. And I could see that there was no nystagmus in the eyes either. Okay. So we're going to move on now to check the muscles of mastication, which is chewing in the face, and it's checking for the trigeminal nerve. So I'm going to sit on the side of the bed again. If you clench your teeth for me and then unclench and keep clenching and unclenching for me, I'm going to place my hands on your face to check for the muscles, okay? So I can feel the masseters, temporalis muscles, and if you open your mouth for me and stop me closing it, and the pterygote are all intact. I would do conjunctival reflex, but for the purpose of the exam we'll move on, and I'm going to test for sensation in the face. So I get my cotton wool. I'm just going to touch you at the top of the chest just so you know what it feels like. And I'm going to ask you to close your eyes, and I'm going to touch you on areas of the face, and I'd like you to tell me when you feel it touching, okay? So close your eyes for me.
Yeah. 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 Yeah.
Okay, thank you. You can open your eyes. Did that feel normal both sides?
Yeah.
And the same?
Yeah.
Okay, so that's fine. The sensation of the nerve of the face is intact. I'm now going to move on to check the muscles of the face. So I'd like you to scrunch your eyes up as tightly as you can for me and stop me opening them. And then raise your eyebrows up for me and stop me pushing them down. That's fine. And puff out your cheeks for me and stop me popping them. And then give me a big grin and show me all your teeth. That's lovely. Thank you very much. Okay, I'll then move on to test the vestibulocochlear nerve, which is your hearing and balance. Have you noticed any difficulty with your hearing at all?
No.
And have you noticed that you're unstable on your feet or have trouble with balance?
No, not at all.
Okay, that's fine. I'm going to do a very crude test to check for your hearing. It will just mean me making a rustling in one of your ears and then whispering a number in your other ear, and I'd like you to repeat the number out for me, okay?
Okay.
Okay.
5. 10.
Okay, so that was fine. So there's no abnormality with crude hearing. If there was, then I could move on to Rooney's and Weber's test, but for now we'll move on with the examination. So now I'm going to test for the glossopharyngeal nerve. Do you have any difficulty swallowing at all?
No.
Okay, and can you cough for me? Okay, that's all fine. If you open your mouth for me nice and wide, I'm going to look at the back of the throat and say ah, and I can see that both sides of the pharyngeal arches move upwards and outwards when she says ah, and there's no asymmetry between them, so that's normal. I'm now going to test for the accessory nerve, so if you shrug your shoulders for me and stop me pushing them down, that's fine, and if you look to your right for me, stop me moving your head, and look to your left, stop me moving your head, that's fine, the accessory nerve's intact. And now if you just protrude your tongue for me and move it from side to side, and that's fine, the hypoglossal nerve seems to be intact. Thank you very much. You can make yourself comfortable. I'm just going to present my findings to my colleague.
Thank you.
So on examination, Catherine Chatfield, who's a 24-year-old female, there was no abnormalities to find on the cranial nerve examination. To complete my examination, I'd like to do a full sensory and motor nervous examination of both the upper and lower limbs, and I'd also like to do full fundoscopy and Weber's and Rooney's test.